Hmm. Good evening, everyone. I hope I am audible. Can you please give me some thumbs up so that I can check whether the audio and video is fine? Yeah. Good evening. Good evening, everyone. Yeah. So we'll just wait for 30 seconds so that student can join. So this session, the original title of the session is the 8-week strategy, and ultimately this is what we will be doing. But I will be taking up your doubts of anxiety and apprehension at this time. So just wait for 30 seconds and then we're gonna start. Yes, thank you everyone. So I hope the audio and video is fine. So we have entered into that time of the phase in a student's life when the exam is around 2 months away, and we start getting uncertainty about the exam. We start getting these rumors about that the exam will be postponed, exam will not be postponed. There are some news which claims that the exam has been postponed. There are some news that starts claiming that the exam will not be postponed. But have you ever tried to understand that who loses in all these circumstances? All right. Now, neither the news channel are losing anything, nor institutes are losing anything. One person who is losing everything is students. That they become uncertain and they stop reading. And it's as simple as that. They start wasting their time. Now, before I tell my views, my first point is whether the exam is postponed or not postponed. This cannot give you a reason not to study. This simply cannot be a reason that you are not studying. Those who know me, those who have attended my class, there is a statement that I have always said, that stop bothering about the things that you cannot control in your life. Stop bothering about the things that you cannot control in your life. Only bother about the things that you can control. And what can you control? That you can study. So irrespective whether the exam will be postponed or whether exam will not be postponed, this cannot be a reason for not studying today or tomorrow. You have to study. And how you have to study, that we're going to be talking in this session. But the first thing is that yes, you have to study. And I mean, don't find out a defense mechanism or a method to decrease your guilt that why you are not studying, है ना. अभी डेट सर्टेन नहीं है सर, इसलिए नहीं पढ़ रहे, है ना. दिस इज अ डिफेंस मैकेनिज्म विच यू आर ट्राइंग टू फाइंड आउट फॉर योर सेल्फ so that you do not study. This cannot be a reason. And this cannot be a reason. All right. Now, first, let's talk about that. What is this happening? So first of all, there is no confirmed news as such where the authorities have postponed the exam. A lot of people are saying that, sir, that if the exam is not postponed, why the notification about the filling the form has not yet come? NBE has already clarified that the exam is gonna be on 3rd of March. Last year also, when the exam was on 5th of March, the notification to fill the form came on 7th of January. And today is 7th of January. Today happened to be Sunday. So if I'll tell you on the basis of some informal discussions that I had, as such, there is no plan of changing the exam date or postponing it to July or June. But since we know that there is nowadays a lot of political interference about the exams, and we know that the central elections are coming up, I think that in the next 3 days, we will get a notification about filling the form. And I mean, but if there is a political interference and the the NBE or the NMC or any authority get an instruction from the ministry to postpone the exam, then obviously this is not in a hand of NMC or any other institutional body. Then obviously they have to abide by the instructions, and then you cannot do much about it. So I think that this year will be absolutely clear before 10th of January, but that again does not give you a reason not to study for 3 days. And what is a standard at this point? We know that our exam is gonna be on 3rd of March. So we will keep our fingers crossed and we will prepare in the way that the exam is happening on 3rd of March. If it happens on 3rd of March and you're not wasting your time, you're in a safe zone. If it postpone and still you are reading for these 3 days, you will take an edge. Okay, who will be sufferer? The person who will stop reading at this point of time will be a sufferer. Whether the exam will be postponed or will not be postponed. Anybody who will stop reading at this point of time is the one who will be a real sufferer in this battle. And it's as simple as that. And we have seen students have spoiled their good preparation in these time. And a lot of time these rumors have been created by the competitors who have not studied well. है ना, अपनी लाइन को बड़ा करना है तो दो तरीके हैं, तो अपनी लाइन बड़ी करो, दूसरे की छोटी कर दो, है ना। तुम खुद भी नहीं, कुछ लोग खुद नहीं पढ़ रहे तो उन्होंने कहा बाकी को भी मत पढ़ने दो ताकि हमारी लाइन बड़ी हो जाए, है ना। सो दिस इज अनदर वे ऑफ टेकिंग इट अप. But now again in these periods of uncertainty, how you work, है ना, maintain discipline guys. Simply maintain discipline. What I will tell everyone, please consider that the exam is happening on 3rd of March. Today is Sunday. So if everything goes well, in 8 week time, you will be free from the exam. The exam would have been over by this point of time, and we will be discussing about how your exam went. And that is what we will be discussing after 8 weeks. So let's think about this 8 weeks plan. Yes, that is what I will say. पढ़ाई करो, exam होगा, है ना. That is what I am saying. Okay, so now 8 weeks. Now what to do in these 8 weeks? Now the plan is very simple. I have not customized anything for you. It's an open discussion. Please feel free to put your comments into the comment section. All right. Now identify that where do you stand at this point of time. Student number 1, sir, I am reading very, very well. My schedule is prepared. My revision schedule is prepared. But this news is disturbing me. And as a result of which I could not study for last 1 day or 1.5 day. I say, bache, my sincere request to you is please keep following the same thing and keep on doing on that particular part. All right. No extra point for you. Please keep on following the same thing. All right. The second thing is, sir, I have completed one revision, but I am unable to, I have completed one reading, but I am unable to concise my notes. I am unable, now I see so much big notes and now it is giving me a fever that how I will be able to revise this particular notes. Please stay in this session. It is going to be very, very useful for you. All right. So this is the second group. Third, sir, I did not study up to this point of time, but I want to give my best in these last 2 months. I want to give a best attempt to it. I'm not really sure whether I can do anything at this stage in these 2 months. And that is why deep inside my heart, this feeling is coming, the exam gets postponed for 3 months or 4 months. So I get 6 months. And this is one group of students who are there. My sincere request to them, try to give your best hard work in whatever time that you have. This session is going to be useful for you. Please try to follow this. And that is how this is gonna be, I have planned for you. Okay. All right. So if somebody asks me, I say I have got 8 weeks. 8 weeks is broadly, if I'm gonna put it, is we have got 56 days. All right. Now the rule is that more number of time you have read a particular topic, the better are the chances that you will be able to recall it in the exam. And this is a simple aspect. Now in the 56 days, there is a limited number of time that you will be able to revise your topics. The rule is straightforward. In the last 17, 18 years of my teaching experience, I can tell you that this has never failed and this will never fail. Your notes, previous year questions or previous year topics, and grand test. This is the key to success. It's as simple as that. And this is a simple, my apologies for this, sorry. Okay, so notes, your previous year questions, previous year topic, and GT is the key to success. Okay, so now more number of time you're able to revise your notes, more number of time you're able to do PYTs, and as many GTs as you have written, you are close to the dream rank that you are looking for. But again, the challenge that happens is, sir, there are so many notes we have taken almost 6 to 7 months. I'm gonna do it. So have you consolidated it? The answer is, sir, yes. The answer is no. If yes, then it is so simple. So my first thing is that first, in these 8 weeks, we will do the revision at least 2 times. We're gonna do the revision at least 2 times. And as we are gonna go close to the exam, we're gonna keep on doing high yielding stuff. What is a high yielding stuff? The stuff that is more likely to be asked in the exam is the high yielding stuff. The stuff that is less likely to be asked in the exam, we will keep on pushing it away from the exam date. The stuff that is more likely to be asked in the exam, we're gonna keep it pushing more towards the exam date. All right. So I have prepared a small part for you, and first is a timeline, and the timeline that you have to do. So for the 19 subjects, I have broadly divided a timeline. I want you to write down this timeline. Try to give, let's say you are starting today, try to give 2 days to the physiology, 3 days to the pathology, 3 days to pharma, 4 days to general medicine, 2 days to pediatrics, 1 day to psychiatry, 4 day to anatomy, 4 day to general surgery, 1 day to orthopedics, 4 days to OBG, 1 day to ENT, 1 day to ophthalmology, 2 days to biochemistry, 2 days to microbiology, 1 dermat, 1 radio, 3 PSM, 1 FM, and 1 to anesthesia. All right. So this is how I want you to give or broadly divide it. All right. Now let's say you say, sir, I have already revised 2 subjects. Let's say you say, sir, I have already revised pharmacology and biochemistry. I say, okay, congratulations. That means you can save 5 more days into that, which can go to the second revision. All right. So now once you're gonna do this, this will be around 42 to 43 or let's say 40 odd days, and then you will be having 18 days. And so broadly 18 to 19 days you have to revise all the subjects in a one revision. So now how to do that? Now in these things, now the first thing that you have to focus upon is previous year topics. All right, previous year topics. If you have consolidated your notes, then just focus on to the just give me a sec to utilize. Okay, just utilize your consolidated notes in a way so that the crux of that particular subject you are able to do. Please remember, at any cost you will not be able to give more than this time to the physiology. At any cost you will not be able to give more than 3 days to the pathology, and that is how you have to do that. All right. Okay. Yeah. Bache, one shot, all these are revision program. These are very, very good if you want to do or revision about this. Okay, I'll tell you a way that how you can incorporate onto this. But first, let me focus onto this point, that how your schedule can be done. Now, how you want to put it, that's your choice. Now, you can go it in the same order in which I have prepared. You want to do, let's say that you feel that biochemistry is a very, very volatile subject. You take biochemistry towards the end. All right. Let's say you want to say, ki, sir, no, I have just finished anatomy. So take the anatomy towards the end. And because anyways you were reading. So it is not always necessary that you have to follow the same order. It's up to you that how you want to create this order. But what matters is that you put up a dedicated time to a particular subject. Please remember, discipline about your studies. Now, what is happening because of this uncertainty? You lose your discipline. All right. Now, a lot of people are, brain is small, how to remember stuff. Always scared of forgetting stuff. Huh? So, dekho, what you remember. If there is a logic behind something, you remember it. If there is no logic behind something, you tend to forget it. I will give you an example. Yesterday, I was going with my daughter to a place, and she told me to remember a number 4579. 4579. And she told me, Papa, you have to remember this number. And it's a number. And it's a simple number. And she told me, Papa, you have to remember this number. I read it once and I said, Ki, okay, I will remember it. She said, Papa, write it down, otherwise you're gonna forget it. I said, nahi, bache, don't worry, I'm gonna definitely remember it. He said, no, Papa, I will ask you after half an hour and you will forget it. Now, there is no logic about this number. Please understand this. You remember something if there is a logic behind it, and I always say, if there is no logic, create a logic. And create a logic. And I said, bache, aaj nahi, you ask me this after 1 month, I will remember that this is a number that you have told me. Okay. Now, what I did is I did a calculation. I said, so okay, it's a 4-digit number that my daughter has told me. So it will start with 4 and then every alternate number added to this. So now I'm thinking, अच्छा 4 5 7 4 5 9 7 था या 4 5 6 8 था. I said no, 4. It was a 4-digit number starting with 4 and then every alternate number 5 7 9 4 5 7 9. So that is how I made a logic. And just to test me, she asked me in the afternoon today, Papa, you remember the number that I told you yesterday? I said, Bache, yes, I remember. It is 4 5 7 9. So how do you remember something is very, very simple. If there is a logic behind it, you remember it. If there is no logic, you have to create the logic. Now, what are the areas where the examiner targets upon? I always say this. A lot of students have requested me. So I'll tell you that what is a high yield stuff. Now, just think about that. What examiner asks you in the paper? If somebody asks me, if I'm an examiner, what I will want to ask you? It's very, very simple. Number one, the first thing that I always try to ask you is an update. All right. You have to read pharmacology or a general medicine for 4 days. So the first thing that you have to prioritize is every update in your subject you have to read. It is more likely to be an MCQ. It is more likely. The new guideline of hypertension have come. It is an important update. You have to know them without a doubt. Number 2, differences between 2 diseases. Whenever there is a difference between 2 diseases, it is more likely to be asked in the paper, because this is an area where the examiner can confuse you. So whenever you are revising the subject, you have to make sure that this topic or this area has to be read. Myasthenia gravis, Lambert-Eaton syndrome, anorexia nervosa, bulimia nervosa. What are the common feature between them? What are the differentiating feature between them? This is something that you have to read in the subject. Now, this is called as hitting the bull's eye, identifying that what the examiner can ask you in a particular subject. Third, exception about the subject. Exception is always an important MCQ. So my rule was that in every subject, I used to remember exception. And if I have remembered exception, I automatically remember the rule. Update in the subject, differences between the 2 diseases, exception. Fourth, life-saving intervention or life-destroying intervention. Life-saving intervention or a life-destroying intervention is always an important MCQ. Alright, a patient has a urethral trauma. Normally, if a patient is not able to pass urine and he has an urge to pass urine, you pass a Foley's catheter. However, if a patient is unable to pass urine and he has a urethral trauma, Foley's catheterization should not be done. So, which can create a problem? Which investigation should not be done in a particular, any patient who has a metallic foreign body in the eye, MRI cannot be done. Any patient who has a pacemaker, MRI cannot be done. So this could be harmful for the patient's management. So life-saving or a life-destroying treatment option is always an important MCQ. Management of the 3rd stage of the labor is gonna be there. HPV vaccine, an important aspect. There is an update in the treatment of carcinoma cervix. This is gonna be there in the exam without a doubt. Update a specific topic. 5th point, very important, very interesting. A common misconception or a common area of a discussion in peer groups about that particular subject is always an important MCQ. And when I was an MBBS student, I used to think that any patient who has an orthopedic implant, MRI should not be done. Once I became a radiologist, I came to know that orthopedic implant is not a contraindication of MRI. You can easily perform an MRI in a patient who has an orthopedic implant. So this is likely to be an MCQ from a radiologist side, because you wanted to see that how well a student has read that particular subject. So whenever you are reading, you have to consolidate the things in a way that these are the areas which you are targeting upon. You are more than 70 to 80% paper is gonna be focusing on all these points. All right, so that is a simple aspect. That is what I will always tell students to focus upon. Any student who has focused upon these 5 areas in every subject, I am telling you, you are able to do that. So that answers the question that if somebody says ki sir my brain is small, I cannot read enough, I say bacche focus on this and focus on this. Sir, I cannot identify, it's very very difficult, I get very much confused, I say okay, follow one thing. Okay, so now I will say a student who has notes available with them, and every student is different. A student who has a notes available with them, you have prepared it from Marrow, you have prepared it from Bhatia, you have prepared it from any other institute, does not matter, you have a notes available with them. Just follow this schedule and revise all the notes using this particular timetable. Sir, the notes are not available with me, what should I do? I say open revision express, open revision express, and revision express, all the videos can be done in this much time. Easily the videos can be done this much time. Sir, what about 18 to 90 days? I say, see, we have everything for you. We have launched one short revision program for you. Each subject, the high yielding, all these 5 important aspects which the examiner targets will be covered in this particular area. Very very quick revision of all the subjects without disturbing your other schedule. You will add one extra set of revision in your preparation. One extra set of revision can be easily added in your preparation using this particular part. But if you are following your own schedule, you think that you are doing very very well, please do not change your schedule for anything. But if you are getting disturbed, if you are thinking that you are having this point that how I'm gonna do the 3 revision, how I'm gonna do the 4 revision, then this is definitely gonna be a very very big boon for you. Okay, all right, so that is about from my side. Now let's take your doubt. But I have already spoken about it. I think you have joined late. According to me, there is no news or no confirmation from the institute about changing the date, and we can expect that we will get the notification about the filling the form in the next 3 days. However, if the authorities get an answer from the ministry, and then whatever ministry say that they have to follow this. So if we do not get any form filling advice in the next 3 days, then there is a possibility. Then otherwise, as of now, the exam is gonna be on 3rd of March. All right, so that is about from my side. Yeah, so yes, Dr. Praveen. So that is my exact point that I have told them, that there are students who create this because they have not studied well, and they want either 2 aspects. But anyways, बच्चे देखो, the subject in which you feel that you are forgetting, my simple advice to you is that please be very very thorough with previous year topics. Now there are certain subjects that irrespective how do you read, you will never be able to be a master of that. But please make sure that any question that is done wrong, right by other student, at least you are on the same page with them. So just focus on previous year questions and make sure that you are very very thorough with the previous year topics. What should be done to increase the GT correct number as it continue to be between 125 to 135? देखो 125 to 135, that you have already crossed a major hurdle, and now you have to first focus upon the areas of the silly mistakes that you are doing upon. You in the GT, we always divide the GT into 4 important aspects: the topic that you know and you did right, the topic that you did not know and you did right, the topic you know and you did wrong, and topic you neither knew and nor you did right. So most of the time, if you want to reach up to 120, 130, we say focus on the first 3 areas. But now if you have already crossed 130, then you should go into the 4th aspect, that in every GT, any topic that you come across that you are not aware, it's a good idea to read that particular topic, and you're gonna see an improvement. If you have reached to 135, it's not a bad idea to add a book like First Aid in your preparation, which is gonna add 4 or 5 extra correct questions in your preparation. Is it okay we start PYT daily subject wise? Yes, that's a very good option, Aroma. And daily subject wise PYTs will give you a sense of completion of your subject also, as well as will add a pretty decent amount of knowledge in your preparation. Regular batch students, should they watch one shot revision video? It will be a good idea even for the regular batch student, because as I told you, these 5 important stuff that the examiner ask are the one, so they will get more confidence about the very frequently asked topics in the exam. So this is not a bad idea to read that. How many GT to write from now onwards? I feel that 1 GT every week is the minimum that you should write from now onwards. What about people who are completing the first reading on January 15? Bache, if you're finishing first reading on January 15, I will say first let's go toward the first reading by 15. A lot of things will become much more clearer by 15, and maybe we will have another session next week to talk about this. But don't change it, just keep on doing the same way as you are doing up to the 15th of January. So I think Dr. Ahmed, the same goes for you also. Is one shot revision is only enough? What is only enough? It will be useful in your preparation. It is gonna add confidence in your preparation. All right. How many unknown questions can be left to avoid negative score? Everybody has different opinion on this. I believe that we should not think too much about the negative. Rather, we should think more about positives. If you will increase positivity in your life, negativity will automatically decrease. And it's very simple. And like a few students gonna put negative comment on that. And a lot of time people send me a message ki sir, why people are, I say put so much positive comments that those negative comment automatically gets deleted from the system. So increase positivity so much in your life so that the negative is not bothered. For every positive, you're gonna get +4. So it will automatically compensate for the negative. So ignore it. And I'm telling you, you gonna learn this life lesson that the moment you start thinking about positivity, you will realize that how small the negativity is. How to accommodate vibe in this schedule? Bache, do vibe subject wise. Whichever subject that you are doing, just add or read the vibe or the component of that particular subject along with the vibe. Sir, I'm squeezing my revision to 31st January, but many topic one shot cover vibe. So vibe is just image based. One shot is a complete revision of every important topic related to the exam. All right. So vibe is a pure image focused on images related to the subject. I'm thinking of solving PYQs for the revision and only revision topic jiska question galat ho. Yes, that's not a bad way, Aditya. That can definitely be done, bache. 135 to 140. So Jay, first of all, this is a pretty decent score, bache. 20 recall mistakes. So please make sure these 20 should come to 0. You're automatically in 160. Your selection to a decent government medical college is assured. A decent government medical college is assured, but obviously everybody has different thought for themselves. Maybe getting a rank in top 1000 is not your aim. It could be top 100 or top 10, and then we have to work more on that. You can read a new question stuff also. That means in a GT, if you're doing a question wrong about a topic that you have never read, there is no harm in reading that particular topic also. I think my first reading will end at the end of January. Yes, Rajat, it will be useful for you, बच्चे. रैंक 1 के लिए कितने मार्क चाहिए होते हैं बच्चे? Depends, but usually 720 out of 800 is a target that one should keep. Biochemistry, don't know what to do. Regular class notes are too much. Okay, let me just put it into this. Regular class notes are too much and rapid revision videos don't reflect regular classes. बच्चे देखो बहुत ही any subject that you think you are very, very weak, please make sure that you are very, very thorough with PYTs of that. That's all. PYTs should be so, so thorough that even if you are sleeping, somebody asks you, you say, oh, this is a PYT. Yes, I know the answer. And I'm telling you, you will not be disappointed. Yes, I will, Mushtri Begum, I will convey your message, bache. Is it possible to get a decent rank? I will be finishing my first reading. Definitely possible. I have seen people finishing 1.5 months before the exam, but they have done very, very thorough reading during the first time, and they are able to get to a very, very decent rank, provided they have not done too many silly mistakes in the paper. So this is very much possible, bache. Bache, if you are not able to go from 84 to 86 correct na, that means definitely you are missing important information that is given in your notes. And I'm sure that you have read the subject very, very well from one place. And if you have read it from one place and you are getting 86 correct, that means 100% that you are missing. And I'm not talking about any platform at this stage, be it any platform. If you are less than 120 correct, that means you are missing information from the standard place from where you have read. And it's as simple as that. TND class from Bhatia is very, very useful platform for the preparation over a period of time, specifically from when I was a student to till this particular date. I can tell you that out of 100 students who topped the exam, 50, at least 50, if not less, are a part of a TND program in some form or other. So they do pretty, pretty well. But obviously, that the TND is test and discussion. You have read the subject at your level, and the high yields, MCQ solving skill, the areas where the MCQs are being constructed are very well covered in the TND program. So this is, you are on a right track. I'm getting 149 correct on the prep ladder, but getting 130 correct on marrow with such kind of variation. So, bache, this is a standard variation that happens. When I was a student, I used to write two GTs at that point of time. One is DBMCI GT and one is IAMS GT when I was a student. And my score of the Bhatia GT and IAMS GT, there was always a difference of around 20 questions during that particular time, because IAMS GT was more towards the difficult side. So my experience in today's time also, that Marrow GT is more towards a slightly difficult side. So there is always, if you compare it with eGurukul GT also, you're gonna see that you will see this 15-20 marks gap. The DBMCI eGurukul, I cannot comment about prep ladder because I have not seen it. But for eGurukul GT, I can tell you that it reflects your nearly exact score that you will be getting in the exam if you're going to write the exam on the same date. I'm taking a lot of time, more than the time given in the revision program. बच्चे इसका मतलब है कि आप ना उस revision program को halt कर करके देख रहे हो, है ना? It cannot be more than the total amount of recorded videos. So if let's say radiology is for 6 hours in the revision program or 7 hours for the revision program, you should finish it in 7 hours. And you say, no sir, I cannot do that. So bache, if we are starting late, this much effort we have to put forward. And it's so simple. Is only NEET PYQs enough? So ideally we recommend that NEET PYQs plus INI CT PYQs both should be done. But at this stage, if you have not done the INI CT PYQs, you can omit them and you can focus on NEET PYQs. Everyone's spreading rumor. So Kriti Bacha, I think you joined late. We have already spoken. Maybe you can back the video and can talk about it. We do not talk about something that we cannot change. Exam date is not in your hand. So stop thinking about that. Reading and studying is in your hand. So let us study till the time we get an official notification or of anything change. My exam date is on 3rd of March and I'm going to prepare accordingly. So please arrange GT review for the same day. Okay, point noted, Dr. Manu. Is 100 questions correct in the GT? Can it be increased? Yes, definitely. Definitely, I can say that 30 to 40 extra questions correct improvement is very much doable in the next 8 weeks. All right. Anxiety is a standard part, bache, and that is bound to happen. That is gonna happen. My suggestion to everyone is that please stay disciplined, stay on track. We have 8 weeks starting today. If the exam happens on 3rd March, and there is a high possibility that it should happen on 3rd March, unless there is an interference from the ministry that neither I can predict nor anybody can predict. But since we have already a committed date from the institute, that we have an exam on 3rd of March, we're going to prepare according to that. My best wishes to everyone. If you think that we can help you out, you want to revise the course in a short amount of time, we have Revision Express plan for you. You can subscribe to that. If you want to do it in a much shorter time with very high yielding stuff, as I already told you, I'm once again telling it to you, an update in a subject, differences between two diseases, exceptions related to the subject, life saving or a life destroying challenges, and a common misconception about your subject or an area of discussion in your subject, then one shot revision program will be really very useful for you. We are starting it in the last half of the January, and we will be finishing it by almost 15th of February. You can add this into your revision program, and I'm telling you, it will be a big boon for you. Last year, students have appreciated it a lot, and this time we're gonna make it far better than what we could do last year. All right. So that is all from my side. Thank you very much for your time, and please let me know if we can do anything else for you. All right. Yeah. So Lakshadweep is on track. I would recommend everyone that let's start going to our own places and to our own country. Our country is beautiful, and yes, everyone should visit Lakshadweep. All right. Chalo. Thank you very much, and good night to everyone.